Night before a commissioner comes. Oh, by the way, we are recording if you don't mind.
That's fine. Yeah, I just your topic was very crucial to what we're going to right now in society. So if Christiana, do you have my slide you can show?
Yes, sir.
Try to put it in. I'm gonna try to, if you could share, if you could share the slide, I'm gonna put it in a context for us so we will know how to operate and where we're going with this conversation. Because the what I call the post-pandemic and mental health is so tied together. We're seeing increased anxiety, depression, bullying, and people say, well, that was going on all the time. But now you're seeing it in a much more increased fashion. So this topic that you all are talking about today around criminal justice, it has to evolve around prevention. And prevention is not one institution. You can't put it on the mental health therapist. You can't put it on the police. You can't just sit it on the community members. You can't put it on the NAACP or elected official. It has to be a collaborative effort. But you got to understand what the root causes are. And I want you to look at these adverse childhood experiences that is listed. And it talks about how we look at the root. And you all talk about these things, and NAACP does too. Poverty, discrimination, lack of opportunity. But we always look at the tree and we see what happens in the tree and how things work. And so what we've tried to do, as a commissioner for me, is how do I involve the mental health and treat it like physical health? And we've done it through our police department, working with them early on in my career to have a crisis mobile unit where we have a mental health person who goes along with the officer when we have a situation that warrants it. I've also trained a county workforce called Mental Health 101, because a lot of them on the front line, and we see a lot of things that can trigger and may need some extra attention from residents that we face. And if you look at the ACE model, it talks about the impact of future violence, victimization, and lifelong health. And a little sidebar, folks are so focused on Atlanta Medical Center closing the hospital, but you all know we closed the mental health hospital in 1997 on Briarcliff. And if you ride down a lot of our streets, I've seen a lot on Candler Road, Wesley Chapel, you're starting to see a lot of manifestations of mental illness that is facing in our community. So we need to put the same attention on mental health and what type of hospitals we have. So there's very few places for them to go. And I think as the Criminal Justice Committee is meeting, make sure that we look at the mental health aspect and how it works in collaboration with our police department, working with the county, and of course, pastor with the faith community, and building a stronger coalition to make things happen. It's not going to work if you're relying on one institution to do the work around criminal justice. It has to be an issue for all of us. And so I'll end with that and just see what other questions you all may have. But it's all about collaboration, partnership, and working together as a unit, because a lot of times the first responders may be the folks in the community. You may see the first episode or outbreak that may lead to some criminal justice or issues that we may face. So I just wanted you all to see that slide, because I think it's very important, and it's all about trauma, and we deal with it every day. So thank you, and I'll close.
Commissioner Johnson, thank you so much for adding in. Anyone wants to get the snippet of the or a screenshot of the PowerPoint, please just go ahead and do that now. Christiana, if you can leave that up for just a second. Are there any questions for Commissioner Johnson? I know he's on the way to the airport and he's going to have to pull off, but we just want to see if there's any questions really quickly.
I've got a quick one. Good evening, commissioners and Criminal Justice Committee. Well, thank you guys for all your good work. Commissioner, just is there a policy issue or change that we can start focusing on so we can reverse this trend of the lack of mental health care in our community? Is it, asking our state legislators to budget more money for it? Is it asking the commissioners to do more? Where do we get the help from?
You have to approach it. You have to approach it from a multi-level standpoint. People need to understand how county government works. See, the county government does not oversee mental health, substance abuse. It's all led by the state. So everything needs to start at the federal and state level. That's where they get their funding from. If you want to look at having a place to take people, because right now, the only place you go for mental health if somebody having an episode is to the jail. And that's the last place a person needs to be. So you need to have more sober houses. You need to have more therapists. You need to have places that's in between the community and the jail for people to get treatment. And that's going to require more funding. But you got to understand, federal government from HHS, SAMHSA, all of those federal agencies give funding to the state. Plus, you got the state, which is Community Service Board, which is on 445 Windway. And they have a treatment facility. They have a place on Hosea Williams if you need therapy. But it's going to require that funding, Mr. President. And you have to start at those levels and bring it to the county and work with us to make those things happen, because we're where the rubber meets the road. People see us the most. And so they assume that we're doing all these services and have all the funding, but we don't.
So the advocacy starts at the state level, state and federal level.
State and federal level.
Okay.
Making the pitch for it and finding out what our budgets are at the Community Service Board level, because that's the place where all of the mental health is done, and seeing what they may need in terms of being an advocate.
And the state funds the community service boards.
Yeah, we give some funding to it, but mainly it's a state function.
Okay. Thank you.
Just like the Board of Health is under the state, not the county.
Okay.
I've got a question. I'm not sure if Commissioner Johnson, you would be the point person for this, but I'd ask. So what brought us to this conversation is the work that they're doing in the city of Atlanta, policing and alternatives diversions. And I am wondering if, like you talked about the crisis mobile health unit, the mental health 101, are there any programs, or are we moving towards that way to have diversion programs? So where our community members that are experiencing being unhoused, mental health and substance use difficulties, where they don't need to interact with the police, where they can meet another level of care to divert them from the jails and prisons and things?
It depends on how you look at it. Even if you look at the program in Atlanta, you will see they don't have space. So you got to ask the question, where are you taking these people? Because there's not a lot of spaces for where you're diverting them to. Because the system was built on physical health. Mental health was not considered part of it. It was like taboo to talk about it. So I think we need to do more around that effort issue, but it's going to require funding, but you got to have a place to go. We're at the point now that therapists right now, like nurses, you have to pay almost triple the cost. And most of the therapists that you try to seek, they don't take Medicare, Medicaid.
Right.
So it's private pay.
Mm-hmm.
So you got to ask the question, why they're not accepting Medicare, Medicaid?
Mm-hmm.
And what can we do? Because most of the people that need to be diverted don't have money to pay. And the ones that they have that's doing, maybe doing public finance, you know how swamped they are, their schedule. Mm-hmm. So you may have a person who get diverted, but not getting the proper treatment. And guess what? They end up back on the street, may be harmful to themselves or to other people. So we have to start looking at the whole continuum of care model, right? Because a one size fit all, one hit program is not going to do it, because mental health is maybe just like asthma or heart attack. People may be at different stages. And a lot of.
Okay, thank you.
I think you just hit your mute button, Commissioner. There
Yeah, I
you
didn't want y'all to hit. I didn't want y'all to hit a plane.
Oh, okay. All right. Well, are there any other questions for Commissioner Johnson? Do know we have Commissioner Terry here, supposed to speak. All right, Commissioner Johnson, listen, have a safe flight. We wish you well. Check with us when you get back just to let us know you landed safely, all right?
I will. And Pastor, I'm going to have Christiana put an event we're doing on October 8th, an empowerment event, and also on the 15th that focuses on wellness and resources. So Miss Christiana will put them in the chat. Please spread the word so we can get people to come out to these events so we can get more resources to people. But it's all going to come around prevention and wellness and working together. So I appreciate you, Ms. Hawkins, for pulling this together, and NAACP for always being on the front line of caring about people. So God bless y'all. Thank y'all.
All right, take care now.
Bye-bye.
Be blessed. All right, that was great for Commissioner Johnson. No, he's a busy man with a lot of things going on. And we're happy also to have another commissioner, new in the area for most of us. District 6 he is, and I met him. He's been doing well in the community. And we would like to hear from him at this time. Now, Commissioner Terry, we are recording. Just wanted to let you know of that.
Thank you, Pastor Speakman. I just assume that everyone's always recording what I say. So, I'll just be 100% transparent as always, as y'all, I think, might expect me or maybe know me to be. I don't like to dance around the issues because I think to a certain extent, the issues we're talking about tonight and there's other issues, of course, out there that are kind of competing for our time and attention. There's an urgency to it. And, I know all y'all know that, and I think Commissioner Johnson really was exactly right in how in that graphic he put up, because when we think about the investments that we make in mental health services, just writ large, to me, that is an investment that will pay a lot of dividends, kind of like a reverse dividend. It's like money that we won't have to spend in the future to manage problems that get so out of hand that they become, unspeakable in terms of human tragedy and loss of life and loss of, other, sort of important things. But also, it's just the criminal justice system is expensive. I mean, it's it's like the biggest part of our budget. Public safety, the courts, the DA, the solicitor, the sheriff. I mean, it's a huge part of where our tax dollars go. And it's not like these things can be done on the cheap. So it's not like there's some secret formula of, we can like cut costs of the sheriff department by 50%. Like there literally is there's no world to which not providing jail and public and police and fire and all the public safety and all the social safety nets is just like, we can just do this on the cheap. And so, this is a hard issue. There are, Commissioner Johnson sort of alluded to that, other cities and counties and other states have different dynamics in their political environment. We were out in San Diego looking at mass transit. Larry and I and Lorraine and Robert and Marta were looking at transit. Lance was there representing the NAACP. And, to hear like some of the policies in place in California that support these types of mental health programs, it was like maybe jealous, like, man, I wish we could get some of that. I wish we could get some of that help, because it's not like mental health, decides to, or, this multitude of issues that are in this category of concern is that, it's not like they just stop at a a city or county border or even a state border, right? It's, there's no boundaries in the impact it has on our communities. And so, we always, of course, start at the local level. What can we do just if we don't get any federal support, any state support, any philanthropy, just what can we do with just in our own systems that we control directly, that we have complete ownership on. Larry, Commissioner Johnson pointed out the Community Service Board. I've had the opportunity to serve as the commissioner appointee on the Community Service Board. There is the Sheriff Maddox is on the board as well. There's MedCura, several residents and citizens and other stakeholders. And so I've really gone to school, Pastor Speakman, on the mental health sort of service delivery strategy in DeKalb County through just understanding how the CSB works as a quasi-state agency, but also has a local mission and has some local funding, but in essence is part of the state mental health system. I know a couple facts. I know that there are over 10,000 unique clients that the DeKalb County Service Board serves every year. It is growing. There is a capacity limit within their organization, but not an insurmountable one, because there are provisions in state law that provide reimbursements for services. And so there is some commensurate funding from the state that's come online in the last couple of years. And I think that's partly because of what Larry was alluding to too, is that, we address mental health and tackle that early on in a comprehensive way. It actually is a public health and public safety strategy. It's a way to actually lessen some of the resource strains that we have on law enforcement and other of our responding agencies and just the community at large. But there is a limit at the crisis center. The DeKalb Crisis Center on Wynn Way has a bed capacity of 42, men and women. It's like one sort of unit, and they have different sides, but they're not segregated. There's like a little space in the middle where they're sort of like the nurse's station. Under COVID restrictions, they've had to tailor it down to about 30, sort of kind of have some social distancing. I'm not sure if they've rescinded that, but there's a capacity limit there. And if the crisis center is at capacity, then the jail might be the only option, because there are mental health services at the jail. There's a contractor, there's a chief medical officer, there's a whole system in place that addresses it at the at the jail level. So there's some constraints there. I am seeing where other community service boards are kind of adapting and changing their models. One of the things that I've seen that's been a very interesting kind of evolution is that as DeKalb County, I think as Commissioner Johnson alluded to, and I think Chief Lumpkin can speak to as well, is that DeKalb has had a co-responder mental health program for 20 years. We were one of the first to sort of embed, to have this clinician, a patrol officer, this unit sort of be the day-to-day, like we're going to go around and we're going to visit with people and try to get them into the continuum of care. Because in some of these situations, by the time it gets to 911, it's an emergency. But how do we intercept and engage those that we know of? And I got a group of neighborhood citizens just down the road from Rockbridge in the Rockbridge Coalition, Lance. It's like in Scottsdale, and there's a woman who is sort of known to the community. She is a person experiencing homelessness for many years. There's the neighbors are complaining. They're like, why can't we get her off the street and get her into a hotel room and get her into a house? Why is the county not do anything about this woman? She deserves some dignity. And part of the conundrum is we can't force anyone. We can, but really we don't. I mean, there's a whole process to force someone to get care. It involves a court order. That is a heroic step to take away someone's rights temporarily. And so the policy is that, we can't force someone to get help. We can't force them to take advantage of our $6 million of rapid housing funding from HUD and the Department of Community Affairs for rapid housing, for short-term, month to 3 month, hotel stays while folks try to get back on their feet. If they don't want help and they're like, nope, this is where I live right here. This is my home. Don't mess with my home. The posture is that we're not gonna mess with that until it becomes a problem, until she's in the road, until which reports are that there's defecating in coolers and on the side of the road. So there's aspects of mental health that are unsavory and disruptive, but aren't necessarily illegal, right? And so this is where, like, as we try to evolve our response systems, this is actually an opportunity for us, I think, to kind of look at this more holistically. The Community Service Board in DeKalb, and I think others like in Gwinnett it's called Viewpoint. They sort of changed their name because sometimes people are like, what's a CSB? That's technically what they're called, but it's an outdated terminology. And actually the DeKalb CSB is considering a branding change because people are like, what does that mean? In Gwinnett, it's called Viewpoints. And Savannah, it's like, open doors or something. It's like kind of like a little branding exercise to be like, we're here to serve you. We're here to help. But some of the CSBs are getting into like the mental health response business. And so we heard the other day that I think Decatur and maybe it was Brookhaven or maybe it was Chamblee, but several city police departments are entering into contracts with other community service boards to be their mental health response agency. And like, obviously, I don't want to be too territorial, but we're like, hey, we got a CSB in DeKalb, like we could do that, right? But it's fine. I mean, I think we're all here to serve, sort of the larger community, and so I don't, it's not like the end of the world. But to me, it sort of showed where for CSBs, they're thinking about evolving and sort of, situating and equipping themselves for the 21st century. They are following, much like I think Ms. Hawkins was alluding to, the work that's being done in Atlanta on sort of a similar track with the Police Alternatives Program, the PAD program. They're trying to evolve and respond to a lot of constituents who are asking, how do we respond to situations that could end in tragedy, that could end in someone losing their life, under circumstances that ultimately get decided in a court of law or a court of public opinion, right? How do we try to short circuit that and put it on a pathway that is nonviolent, that is compassionate, that has dignity? And so I think this conversation that the CSBs are having, and I think law enforcement is having, is a really important point of that. And I want to kind of hone in on that point, because I think the question earlier was like, what is a policy that we can implement that would like begin to move things forward? And I'm sort of in the posture now as a public safety committee chair to ask that question of what is it that we can do to sort of pivot or paradigm shift to respond to some of the challenges that we're seeing in the environment. The number one challenge that I think, and I'm sure I want Director Lumpkin, he knows a lot more about these issues than I would. I'm really learning more and more about them as I get more. Larry has 20 years on me, so I got a little catching up to do. But one of the things that I think is sort of on the table for discussion is how that co-responder model and that program evolves moving forward. Because just like this program has been in existence for 20 years and was really on the forefront of sort of, during its day, wow, we're going to have a clinician with a police officer, like that was groundbreaking at the time. And I think what this community service board leadership and staff, and I think the mental health kind of experts have been sort of opining on and experimenting with is, what happens if we sort of build out a more multidisciplinary team? Because sometimes that mental health clinician is really responding to a set of circumstances, but there might be this whole other set of circumstances, or there might be some layers or intersections of that circumstance that become easier when another, issue is addressed. And so the models around the country that I think we need to be exploring and looking at are like in Denver, that's called the STARS program. And it is kind of a multidisciplinary team that involves law enforcement, but also has a community response to it. In Oakland, the Oakland Fire Department is the mental health response agency. That's just like the direction they went. They said it makes sense. Our firefighters are responding to most of the calls anyways, which is also the case in DeKalb. A lot of firefighters are responding to those, those calls as well. Let's go ahead and build up their capacity to be that sort of the agency that owns that work. In Oregon, there is a program called the CAHOOTS model, and CAHOOTS stands for like Community Action for Health something, or team or something, right? But in essence, there's no law enforcement, there's no firefighters involved unless necessary. But in essence, it is a community health clinic that has been in the community for 40 years. And that community trusts that health clinic because it's their federally qualified health clinic. And tens of thousands of people are, serviced by it. So they trust that clinic, they trust that model, and they got a van with a team of, health specialists that go around, and they don't respond to necessarily the emergencies, but they respond to the usual suspects. The ones that, that some of our clinicians at the CSB, clinic would say, oh yeah, we know them. Yeah, they haven't been in 6 months. Yeah, now when we get them in here and they get on their medication and they get on their service plan, they do so much better. But then, and folks who, I don't work in this directly, but I've been around people who work in addiction specialties, who work in sort of mental health recovery. Every patient, every client has their own plan that has to be developed for them. There isn't a one size fits all mental health plan. It is literally person per person. And so everyone needs their own individualized sort of pathway. And so I think as we move this conversation forward, we have to recognize a little bit of our capacity limits. We know that across the country, law enforcement recruitment is down substantially over just recent years and certainly years ago. It has been hard to recruit, enough recruits to kind of keep that pipeline of new officers coming in as folks retire or, there's an attrition. And so, one of the limitations of expanding the mental health response team in DeKalb is that, the model right now is we have to have an officer with a clinician. And if there's not enough officers or if there's a capacity limit there, then we can't move forward with the clinician, right? And so, so I think that is kind of the policy question is, do we continue with the co-responder model and just sort of make a concerted effort to recruit officers to like that's going to be their job, and maybe that's the way to recruit officers? I don't know. It could be sort of a recruitment tool for officers that sort of want to specialize, in that work, right? I know a lot of our officers, I think almost all of our officers actually get that crisis intervention training. But maybe, as we know with all trainings, there's like level 1 and level 2, and, there's always more continuing education that can be done. And so maybe, there's a paradigm where, recruitment of officers that want to go into that unit is something that's sort of, part of the recruitment strategy. We could try to do a hybrid where, maybe instead of expanding more officers, we expand the other disciplinary roles. Social workers, not just clinicians, but it's sort of a combination of psychologists and psychiatrists. It's sort of that kind of realm. Community benefits navigators. One of the things that I've been made aware of over the years is that there are millions of dollars of programs that are funded to help people who are in need that qualify for the programs. But if they don't know that they qualify, or they might be missing something, or maybe they didn't get an application in on time, or they didn't fill out the paperwork the right way, they lose out on those benefits that the federal government has put in the budget. And, we know Health and Human Services, I think it was like almost $900 million a year comes back to HHS because programs were funded based on census numbers and, DeKalb population growing this much. So we're going to need to have X number of dollars per population in this area. But then if it doesn't materialize, then that money just goes back to the federal treasury. And so, a benefits navigator, whether that's community benefits or health benefits, I've been made aware that sometimes Medicaid and Medicare paperwork doesn't get filled out. And then there's also that other category of people who do have coverage that just don't get it. They choose not to, elect to get that. And so part of kind of the, it's kind of like the Cahoots model and a little bit of the Denver model is like, it's an embed in the community where we're always talking to the usual suspects that we know, like they just need a little bit of help. They just need like a little bit of guidance, a little bit of navigating, a little bit of support for their family, who are also, family members are a big part of this. Because as, Larry Johnson mentioned, because a lot of the mental health funding went away, it really fell on, family and friends to sort of kind of take over that care gap. But then, of course, if a family member gets to that limit or something happened, then now individuals are completely out there alone. And if you want to talk about a spiral into even worse situations, think about someone who's already on the edge. Now their brother or their daughter is like, "You're done. I'm never talking to you, ever again." What kind of crescendo that has on someone, and then, kind of recovering from that. So, I hear a lot of families who have members who are in the mental health system. They're crying out like, just like those 10,000 clients, there are 10,000 families behind those individuals who are also the caregivers for that. So this is the other part of the equation. How do we support family members and, that kind of that larger community with the support that they might need? And sometimes they don't need money. They might just need some guidance or some expertise or just something that kind of gets them to that next level to, to see their folks get back on, the right track. So I'll pause there because, there's a whole, I got to tell y'all, the mental health issue is multifaceted. Probably one day in the future, we need to think very holistically about how we tie together the mental health response programs in DeKalb County, because when I look at all of the silos of government that have a piece of the mental health puzzle, we're talking about certainly all the public safety departments. We're seeing community service board, quasi, governmental. We're seeing the hospitals, of course, Grady, Emory, Emory Hillendale, the VA, like they have their piece of it. There's a school component to this, a school system component that has its impacts on the larger community. The Department of Community Services, that is the department that receives the HUD funding to address homelessness and rapid housing. So we have a whole department that goes out and interacts with people, but they have a rule. They will not put someone in a hotel room if they think there's only going to be a liability. And so they can only respond to a certain subset of those who are experiencing homelessness. It's maybe more in the category of someone, who doesn't have a mental health crisis. They literally just got evicted and they just are down on their luck and they just need some help right now. And we got help for them, right? But there's so many little silos, and they do overlap. They do folks talk, and there's good coordination between CSB and the police department. And I think that system is really strong. But there's still some gaps there. There's still some kind of connections. And so what we're seeing in other large urban counties, especially like the Denvers, the Chicago's, the Cook counties, the Austin, Travis counties, the San Diego counties, they are developing, chief mental health officers. They're making it sort of like a department or a cabinet position in and of itself, because you have to sort of coordinate across all of these entities and departments. And, just like Commissioner Johnson said, I mean, the counties are funding all of the constitutionals, we're funding all of this, the courts. There's a connection point across the board. And so that's, we just need to kind of evolve our governmental systems to respond to the realities and the challenges that we're facing, right now, and that we see becoming a little, I think more exacerbated in years to come. And again, this is all in the effort, this investment that we make now, I really believe will save us a lot of time, energy, heartache, and certainly tax dollars into the future. Tax dollars that I guarantee you folks are like, can we fix this pothole? Can we improve this park? Can we, build another fire station? Can we have an after school program? Like these are things that come up in government as we look at a narrow slice of available funds with a list of demands that, are 20 years long. And so trying to find that balance is always a struggle. But if we focus on what's going to, be the most efficient use of service delivery, as well as what's going to, sort of create that larger community benefit, then, I think we're doing right, and sometimes it does mean spending a little bit more money. Last point I'll make is, and this is just something, a nature we're having this conversation now as we are looking at the mid-year budget adjustment. The mid-year budget had $37.8 million in requests that came from departments from sanitation, watershed, stormwater, the unincorporated fund, which is related to code compliance, trail maintenance, fire equipment, facilities improvements, courthouse improvements, sheriff repair, jail repairs that are vital, and the current sort of proposal from the CEO is for $27.8 million in enhancements in all of those department areas. But there's no mental health funding in that budget request. We've put a lot of funds in ARP in the last tranche to sort of, put some more money behind, these initiatives. But, at some point we do have to kind of recognize that for many years, the county was, financially strapped, recovering, took longer to recover probably from the recession because of how big of the tax digest is residential. And so the housing market really is, sort of is our destiny in terms of our tax revenues. And so I think a lot of there was a lot of reticence for many years to really invest in programs that maybe weren't as tangible as the ones that we're talking about. Because if you invest $1 million in mental health, some people might not ever actually see it. Whereas if you spend $1 million on a new sidewalk, people will see that. And so I think the general kind of posture of local governments is let's spend some money and let's build things, and let's do things that are going to be, tangible and going to really, sort of exist. Community services and mental health services and after school programs. I mean, those are things that, you can't build it and then it's there, right? It's every day, it's every week, it's every month from year in and year out. Mm-hmm. They become ongoing liabilities as well. So you spend $1 million on roads, that road's done, we'll maintain it, but it ain't $1 million a year. You put $1 million in mental health programs, and if you take that $1 million away the next year, that's a problem, because you were addressing a problem and now you sort of said, okay, now we're done with it. So I think we are going to have a conversation in future budgets. I want to say it's like 7% of the Cobb County's $1.6 billion budget is spent on human beings in terms of like community and human services. So, and I'm not saying like that's like, I think that's just the nature of like like watershed and public safety and fire and court, like, that budget is always going to be vast and have a lot of categories that have to constitutionally be funded. But, you know, when we look at the growth in the tax digest, so as new development comes online in DeKalb, and a large reason why you see that $27 million increase in the budget is because we have $27 million in new taxes coming in because we kept the millage rate exactly the same. It didn't go up, it didn't go down, but because everyone's property value, not everyone, but almost everyone's property values went up from last year to this year, we just collected more money. And part of that is, you know, speculation in land value. The other part of it is that we've, over, you know, the last 5 to 6 years, developments were approved and a townhome community was built here and a multifamily was built there and a mixed use was built there. And so land that was worth $500,000 is now worth $20 million, you know, and so we're going to get more taxes from that. Mm-hmm. And so just, you know, consider that, right? So new developments coming online, it's new. A lot of it, you know, there are affordable housing and affordable aspects of that development, but a lot of this new development is luxury development. Almost 97% of multifamily units in Metro Atlanta that are being built are considered luxury. And that's a broad definition, but it means you got granite countertops, you got a pool, you got a dog park, you have a gym, you have a little office, you know, a little office space, you know, you just have like nice things, right? And you're not gonna, you know, shoot down anyone wanting to have nice things, but, you know, an equitable response to gentrification and new development and luxury living and luxury things is to say there's a whole lot of other people that are, you know, who live next to an abandoned, burnt out apartment complex that was built 60 years ago, and they built it with horrible design standards and horrible building codes, and it's falling apart. And people are suffering because they're living there. And is the solution to tear down that complex and put up a luxury complex? Well, maybe not always, but sometimes maybe. Is it to refurbish it and try to, you know, get new, you know, past or current owners to renovate it? That could be one of the solutions. And I've got lots of ideas and answers to all those questions. But when I think about the growth of DeKalb County, whether it's population or economic development, if we don't see commensurate investments in the programs that we've already been investing in, then at some point we're going to get this high and we haven't kept up, and it's going to bring everything down. The last point I'll make here, the hospital closure, that right there, we're going to see mental health and negative impacts, not just in Fulton and DeKalb, it's going to be all over Metro Atlanta because of that eventual closing. You know, Grady has, I guess, temporary funding to kind of, you know, address it. But let's be honest, y'all, the reason why Grady exists or existed from the get-go is because Fulton and DeKalb County taxpayers have been funding a significant portion of it through our millage rate. And a hospital closes, and all of a sudden there's, you know, potentially thousands of, you know, patients that either can't get direct service or are having to go to other places or just aren't getting it, period. You know, is going to strain so many other aspects of our system. And Larry was exactly right. We're going to pay for it, you know, so we always continue to push for state and federal funding. I know that we apply for almost every grant. Every time our lobbyist sends us a federal or state grant, it got sent to Director Lumpkin or Chief Ramos, and there's been some good ones that we've seen come online. So this is encouraging. But we're going to have to, you know, find ways, I think, to, you know, the point earlier, you know, to, as we see DeKalb County become a wealthier county and see more economic development, we got to keep those investments commensurate and on par with what we already know is a capacity constraint. Because if we CSB probably, if they had more capacity, I mean, thousands more clients could be sort of in their portfolio, but there really is a limit right now. All right, so I'm sorry, I filibustered too long, Pastor Speakman. I've got try to lay the stage on all the issues, but I'll pause there.
All right, thank you so much, Commissioner Terry. You tickle me. It's almost like an old Baptist preacher. I'm getting ready to close, and it was like 3 times you were saying. It's all right though. I understand.